Headphones on. 3 ultra deep extractions in 8 seconds. Ready? Today we're going deep. Real pimple popping, crisp ASMR, and dermatologist-informed techniques to keep skin clear without damage. Great extractions start long before a tool touches your skin. This preparation is the most crucial, yet overlooked step. It's not just about getting clean, it's about creating the perfect, softened canvas for a safe and effective extraction. Rushing this process is a primary cause of irritation, inflammation, and scarring. By dedicating time to this ritual, you ensure the procedure is not only successful, but also gentle on your skin's delicate structure. We begin with a thorough cleanse. Choose a gentle, fragrance-free gel cleanser, as gels rinse away completely without leaving residue. For 60 seconds, massage the cleanser into your skin using slow, deliberate circles with lukewarm water. The temperature is key. Hot water can trigger inflammation, while cold water constricts pores. This gentle motion and warmth begins loosening hardened sebum. Focus on the areas you plan to treat, like the T-zone, feeling the texture change as you work. After rinsing, gently pat your skin dry with a fresh, soft microfiber towel. Never rub. Now, we introduce warmth to soften the contents of the pores. You can use a facial steamer, keeping your face a safe distance away for 5 to 10 minutes. Alternatively, a warm compress is just as effective. Soak a clean washcloth in warm, not hot, water, wring it out, and press it against the skin. This crucial step makes the sebum plug pliable, allowing it to be eased out rather than forced. With your skin prepped, it's time to map your pores. Always wear gloves to maintain a sterile environment. With a gloved fingertip, gently trace the landscape of your face, the crease of your nose, the curve of your chin. You're feeling for the direction of hair follicle growth, as applying pressure against this angle can cause damage. Most importantly, identify which pores are ready. A ready pore has a visible blackhead or a distinct whitehead at the surface. A blemish that is not ready is a red, inflamed bump without a visible head. These should never be touched. Forcing an extraction here will only lead to trauma and a worse outcome. Welcome to the Deep Extraction Stack. This is our core methodology, a sequence of 3 distinct techniques designed to work in harmony with your skin, not against it. Our goal is never to force a release, but to gently assist what the body is already trying to resolve. By following this precise order, we ensure the cleanest, safest, and most effective extraction, minimizing inflammation and dramatically reducing the risk of scarring. Each step builds upon the last, creating a pathway for a gentle, complete release. Let's begin. First, cross compression. This is our primary and most gentle technique. Using 2 cotton swabs, approach the lesion from opposite sides at a 45-degree angle. This angle is critical. It ensures you are applying pressure underneath the impaction, not on top of it. Gently roll the swabs inward and then slightly upward, like you're coaxing the contents out from the base. The motion is a slow, deliberate squeeze and lift. If the contents don't release with minimal pressure, do not force it. Pause, allow the skin to rest and reassess. Patience is your most valuable tool. Second, the loop lift. This is for stubborn impactions that have been brought to the surface by cross compression. Position the rounded edge of the Comedone tool around the pore. Apply very light, even pressure downwards, and then gently pull or lift the tool across the pore. Think of it as a scoop, not a press. This motion uses the tool's edge to ease the blockage out. After each pass, wipe the tool clean on a sterile pad. This prevents recontamination and allows you to see your progress clearly. Never drag the tool across the skin. It's a precise press and lift. Finally, the micro edge assist. This is an advanced technique reserved for pustules with a clearly visible, superficial white head. Using a sterile lancet, you are not piercing the skin. Instead, you are creating a tiny, clean exit channel by lightly nicking the very surface. Hold the needle almost parallel to the skin and gently graze the edge of the whitehead. This provides a path of least resistance. Immediately follow with a gentle loop lift or swab compression. The contents should now release without any significant pressure, preventing trauma to the deeper follicle wall. These 3 techniques, used in sequence, form a complete system for safer, more effective extractions. By respecting the skin's limits and providing gentle assistance, you support the healing process from the very start. The satisfying one. Warm compress, 15S. Cross compress edges, single loop lift. If content flows, maintain gentle, even pressure. Stop the instant you see fresh blood. What you do now decides whether you glow or scar. Soothe. Thin layer of aloe/centella/panthenol gel. Protect. Hydrocolloid patch on open spots overnight. Moisturize. Light, non-comedogenic gel cream. Pat. Don't rub. The golden rule of clear skin is simple. Prevention is always better than extraction. Your key player is beta-hydroxy acid, or BHA, most commonly salicylic acid. Because it's oil-soluble, BHA penetrates deep inside your pores, dissolving the stubborn mixture of sebum and dead skin cells that leads to clogs. Apply a 1 to 2% solution to your T-zone 2 to 3 times a week, always at night to minimize sun sensitivity. For a gentler complementary treatment, add an enzyme mask to your weekly routine. Formulations using natural enzymes from fruits like papaya and pumpkin refine skin texture by gently dissolving the outermost layer of dead skin cells. This reveals a smoother, more radiant complexion underneath, enhancing the deep cleaning work of your BHA for superior luminosity and preventing surface dullness from setting in. Be mindful of your shower routine. Hair conditioners contain rich oils and silicones that, while great for hair, are highly comedogenic and can clog pores. As you rinse, this residue washes over your face. To prevent these conditioner breakouts, adopt one simple rule. Your face is the last thing you wash. After your hair is fully rinsed, perform a thorough facial cleanse to remove any lingering, pore-clogging residue from your hairline and face. Finally, don't neglect textile hygiene. Every night, your pillowcase accumulates oils, sweat, and skincare products, creating a breeding ground for bacteria. Pressing your clean face against this surface for hours undermines your efforts. Make it a non-negotiable habit to swap your pillowcase for a fresh one every 3 to 4 nights. This simple act ensures your skin's nightly regeneration happens on a perfectly clean surface, a small effort for a substantial reward. Which moment was your favorite? The cotton cross compress, the loop lift, or the giant clean release? Comment POP if you want a full-length extraction supercut next.